Our next session in the conference is a keynote speech from our Shadow Minister for Children and Families and Member of Parliament for Hampstead and Kilburn, Tulip Siddiq. And Ms Siddiq was appointed as Shadow Minister in Education in April of this year, previously a Shadow Minister for the early years in 2016-17, and she's also been a member of the House of Commons Public Administration Committee and the Women and Equalities Committee, and we're really pleased to be able to hear from the opposition spokesperson this morning to contribute to our discussion on these questions. So over to you, Tulip Siddiq.
Thank you very much, Nick, and thanks to all the Early Intervention Foundation for hosting this important conference and for all the work that you do to champion children and young people and the transformative power of early intervention to change the lives of those who are at risk of having problems develop. And thanks very much for the invitation to speak today. It's really an honor, and I'm very grateful for the opportunity to share my thoughts with you all. Even though I can't see you all, sadly, I'd like to thank everyone who's taken the time to tune in and listen to what we all have to say. I've been asked to set out what I see as some of the challenges facing children and young people at the moment. And honestly, I have to say, I find it hard to know where to start. Younger people may be at significantly less risk from COVID-19, but there are very few who haven't faced extreme uncertainty and difficulty in the COVID crisis, and they have far too often been forced to bear the brunt of the pandemic in so many ways. In some ways, I speak from firsthand experience, having two very young children myself, but I know how fortunate I am to have the life that I do have, and the fact that the children have probably gone through an easier time than most children. But I also see it from the work in my constituency, and especially in the deprived parts of my constituency. 2 million children faced greater threats during lockdown, from domestic abuse to online grooming, yet referrals for children's social care services dropped dramatically by as much as 50% in some areas. And we still haven't seen the problems that we know were developed or exacerbated during lockdown reflected in children being referred for help. That means that many thousands of children who are struggling or facing potentially very serious problems are hidden from view and from support services. Hugely disruptive changes, from school closures to restrictions on socializing, have had a huge impact on the well-being of children, with 80% of respondents to a Young Minds survey saying that their mental health has worsened. Many have been dealing with very profound isolation without their usual support networks and support through schools. The NHS, charities, social care, and the mental health services have often been harder to access, with teachers unable to identify problems in the same ways as usual. I know it's been particularly tough for children with special educational needs and disabilities whose rights were diminished just as they and their families needed support the most. Then there's obviously the year 11s and year 13s who've had to deal with chaotic exam cancellations, and the year 10s and 12s whose work towards GCSEs and A-levels have been massively set back. There are the younger children who found it very difficult to learn or socialize remotely, which we know will further widen the disadvantage gap. There's also nearly 1 million children who haven't had access to laptops or the internet at home, who were cut off from friends and learning during the first lockdown, and many who still can't get the digital equipment they need to learn from school if they're forced to self-isolate. The list goes on, and that's without mentioning the fact that 200,000 children were skipping meals at the height of the pandemic, and many more face food insecurity on a daily basis, which has huge impacts on well-being, education, and development. Despite these huge challenges that children and young people have been facing in the pandemic, I'm afraid I don't think they've been put first in this pandemic, and I think they've been treated like an afterthought in policy making. There's so many lessons to learn from past mistakes, which we need to apply as we plan the recovery from coronavirus. And I know we will hear many at this conference, but there's something fundamental that needs to change, in my opinion. We need to move away from the idea that you can keep slashing away at council funding and still expect good outcomes. Over £2 billion has been taken out of children's services since 2010 as a result of cuts to local authority budgets. And I saw this firsthand when I was a local councillor in Camden before I became an MP. And leading children's charities have argued quite rightly that this decade of salami slicing left us unprepared for when COVID-19 hit. The cash injections we've seen this year have been necessary, of course, but they don't even begin to scratch the surface of the funding gaps that have developed. Recent analysis by the sector has confirmed that this is the areas where unemployment and deprivation is highest that have seen the largest falls in funding for children's services over the last decade. A serious concern of mine, and one I know that the Early Intervention Foundation has at the centre of its mission to address, is the fact that relentless cuts to council budgets from central government have inevitably led to a focus on crisis management rather than preventative measures that could stop problems ending up at crisis point. So we've got children who need not to have gone into care ending up in care because they couldn't access support early on, and others bouncing in and out of care rather than having problems properly addressed. It is shocking that more than 1 in 5 children who were referred to social care last year have also been referred the year before. Far too many young people have far too often been unable to access mental health support until it is too late. Obviously, the threat to children is our main concern, but this gradual whittling away of support services doesn't even make sense financially, in my opinion. It is a false economy where we end up spending more in the long run on crisis management and areas like youth justice and the health system to deal with problems that could have been addressed by well-resourced and targeted early intervention services. We have a moral responsibility to fix this, as it is holding children back and putting far too many in harm's way every year. To coin a phrase, we must build back better after this pandemic. We cannot go back to how things were before, with a broken system that neither gave children the support they needed nor the best possible start in life. I look forward to working with all of you over the next months and years to make sure this case and push for the relentless focus on early intervention that we know is essential if we want to properly support young people. Thanks again for the opportunity to speak today and for listening, and I hope you enjoy the rest of the conference.
Indeed, Tulip Siddiq there joining us and setting out her thoughts on the future of early intervention, the future challenges that we face. We're very grateful to you for joining us this morning, Tulip, and contributing to our conference. Thank you very much indeed.